Hi, this is Dr. David Klein with Stages of Life. In front of you yet one more time. What we're going to talk about now is staying healthy. What can you do? What should you do? What can your family do so that you don't end up as roadkill for the next pandemic? As it turns out, these sorts of infections never really entirely go away. The epidemic will abate. They never hang around for very long. A year, sometimes two, but usually it's a matter of a few months and then it disappears. In this case, it's going to travel south. It'll go to the southern hemisphere. It'll exist for some period of time. And then as the weather changes, it comes north again. Very much like migratory birds. When do we see these sorts of things? When the birds show up, the viruses of this nature tend to go in the opposite direction. When do things tend to clear up? When the butterflies start to fly, because that usually means it's warm enough for the butterfly's wings to work. There's a reason why they hang around the sun, gather up a little bit of heat. That way their muscles work properly. Otherwise, they get stuck to the bushes. So what can you do to stay healthy, waiting for the next time, and in fact, prolonging your life as well? So nutrition is what this is all about. It's not going out and saying, well, gee, I'd like you to stop hang gliding. That wouldn't be a bad idea. Well, do you necessarily want to not do tumbling in school? Probably the most dangerous of all academic sports is gymnastics. Equestrian. These are all things that are likely to put your life in danger. I'm not going to talk about it, okay, because you already know it's an issue. But what can you do to prolong your life? And the first thing I'm going to talk about is cutting back in sugar. Of all the things you can do in your diet, sugar is probably the most damaging. Why is this the case? Well, sugar, fructose, is actually more addictive than cocaine. It's more addictive than cigarettes. It's more addictive than alcohol. Very hard addiction to kick. So what do? You stop it cold, but you certainly don't teach your kids that it's a good thing. Giving them sweet treats is teaching an addict, a potential addict, the wrong lesson. When I was growing up, we never had sweets around the house. We didn't have sodas in the house. They were considered to be poison. Great advice. I didn't have any of these things in my house until I got married the first time, and that was the end of that. Now we're back to baseline. Got married a second time, between you and me. Now we're back to not having sweets in the house again. It will, in fact, prolong your life. Fructose inhibits the insulin receptor. This can actually beget things like cancer, hypertension, right on down the line, obesity you would expect. So pull the fructose. Second thing is pull soy out of your diet. Why? Because it lowers your temperature, lowers your basal metabolic rate, and actually puts weight on you. How does this work? By inhibiting thyroid function. And by giving somebody soy and fructose, it's a guarantee to gain weight. After all, this is how you increase weight in cattle. When you put cattle in a feedlot, you give them two things, soy meal and cornmeal. What does that work out to? Fructose and soy. It puts 30% fat on a head of cattle in 6 weeks, and it will fatten your tail up as well. Really decent advice to take care of yourself. Peanuts, almost as bad as soybeans, so you want to pull soybeans and peanuts. Now, that being said, what can you do to start the process now of reducing your weight, reducing your dependence on things like fructose? And we're going to start with minerals. What's it all about? Our diet is deficient in micronutrients, most principally mineral in nature, because it's not in our vegetables anymore. It just isn't there. We have overcropped the fields, and so as a result, minerals like magnesium, calcium, vanadium, chromium, selenium, zinc, they disappear from our diet. They disappear from the diet, and your body cannot create them. That is the nature of an element. A mineral is an element. It's not something that can be created or destroyed, except maybe in an atomic pile or in the core of the sun. That's what it takes to make an element. Certainly not something that's going to happen at room temperature here. So the product that I prefer is called Magic Minerals. Why? Because it's a balanced mineral chelate. Magic Minerals is something I put together for my daughter when she was 10 years old. Zinc, selenium, vanadium, chromium. Those are the principal ingredients, as well as calcium and magnesium. And there are others in smaller amounts. So it was called Daddy's Magic Mineral because that's what it took for my daughter to take it. Okay, she was proud of her daddy at that time. No longer, but however, back in the day she was. So we took the daddy's part out of it when she turned 18. Now she's 30. This is a marvelous product. It's inexpensive. You take 2 capsules twice a day. It'll make you start feeling pretty good in about 3 or 4 days. Fascinating how it's permissive. It doesn't make you do anything. It allows your body to function. It gives you just enough zinc to get you past infection. It gets you just enough selenium to prevent or treat thyroid disease, just enough vanadium and chromium to get you started with regards to diabetes. There are other things that you certainly want to do. What else is necessary for your body to work? Essential fatty acids, or EFAs. Omega-3 fatty acids are principally what you're looking for. Omega-6s, omega-9s are poison. You want to pull them out. So if you're taking fish oil that has omega-3, 6, and 9, and you think you're doing better than the omega-3s, you would be sadly mistaken, and you are fooled. How do you like that? Okay? It's probably not the first time either, is it? So omega-3s are what you want to be taking. How much omega-3? Okay, you add up the EPA and DHA. That's eicosapentaenoic acid and docosahexaenoic acid. Does that matter? The answer is no. What does matter is that you take those 2 numbers and they should exceed 1,400 for an average adult. That's not the size of the capsule, it's the amount of EPA and DHA. So the ones you want have to be assayed. Alpha lipoic acid is another important omega-3, but for purposes here, we're going to limit our discussion to the first 2. What do these do? They allow the body to create steroidal hormones. These are the building blocks necessary for you to create the command and control mechanism that your glandular system uses to work. Very, very important sort of a thing to have. Okay, so minerals as well as the essential fatty acids. What else do you think you might need? Essential carbohydrates. You're going to, whoa, what's an essential carbohydrate? That is something that your body cannot create de novo from other raw materials. What do these do? They are involved with cell-to-cell interaction. Now, can you go out and buy them? And the answer is, of course you can. It's an expensive way to do it, or you can go buy fruit and vegetables that have color in them. And then all of a sudden, you're going to start getting those little bits and pieces that are necessary for your body's immune system to work, the cell-to-cell communication. Do we sell them at stages of life? The answer is yes. Do I encourage people to buy them? The answer is no. I would far rather that you eat properly, okay, and you'll get them in your diet with very, very few exceptions. Do you need probiotics to stay healthy? And the answer is not necessarily, unless you're taking antibiotics or have taken them in the recent past, or unless you have something like ulcerative colitis or Crohn's disease, celiac disease. These individuals frequently need probiotics. But the rest of you, save your money and move on to something that might be more important, like essential amino acids. These are things that most people don't get much of, because if you're going to go out and buy yourself fast food burgers, most of those things are laden with soy, and you're not getting the appropriate amino acid mix. So what I prefer folks to do to get the essential amino acids isn't to go out and buy protein bars. Most of those are made from soy. They're poison. You get whey-based protein mix, okay? So you're looking for a whey protein that's made from milk. It does not have any casein and it does not have any lactose in it. So there shouldn't be any problem for those of you that think that you're lactose intolerant and you can't handle whey. Well, whey protein works very, very differently, but it is as close to what we're looking for as human beings as you can get. Why? Because protein from a cow is closer to human in ratios than pumpkin or pea. Okay, it's just the way it works. And if you're getting soy protein in those big cans, you're really killing yourself slowly. So fats, oils, we've talked about now, essential fatty acids, minerals. What about vitamins? Now, what's a vitamin? A vitamin is an enzyme cofactor. Your body needs them for enzymes to work. A mineral, for purposes here, is also an enzyme cofactor, but it's inorganic. So do you need vitamins, vital amines? The answer is yes, you do. Your body cannot create them. So is it enough to go out and buy a B complex? That's part of the way. There are over 50 B vitamins. If you read the ingredients in your B vitamin, I'll be willing to bet you there's not nearly what you need. Vitamin C, modest amounts. Vitamin A, modest amounts. Vitamin E, there are 6 of them. Very few people actually need vitamin E primarily, unless you're elderly. You know, most everybody else can get by without it. Vitamin D is not a vitamin, it's a hormone. Do you need vitamin D? 40% of the population does. Vitamin D3, dog 3. You always take it with a fish oil, otherwise it doesn't absorb very well. So yes, these are the sorts of building blocks that you're going to need to maintain your health. We have a product called Down to Basics. The one to get is without iron, unless you're a heavily menstruating female, in which case the iron is good for you. Down to Basics without iron, and you read the ingredients on there. It will tell you pretty much what you need. So go to stagesoflifevitamins.com, search for Down, D-O-W-N, look at the label, just read the label. That is what you're looking for. You can buy our product or you can search it out and try to find something better. I don't think you'll find anything better, but you make yourself happy. But look it over. It'll give you a general idea of what the average supplemental needs is. The supplemental need might be for the human adult. Okay, children, it's a little bit different. You have to cut the dosage back a little bit, but not tremendously. And then there are many other things that you do for disease or condition-specific issues. But that's beyond the scope here. This is Dr. David Klein at Stages of Life Medical Institute, Longwood, Florida, wishing you a happy, healthy summer. Okay, once things warm up, it's warm here. Once it warms up where you're at, I think you're going to find there'll be fewer sniffles, coughs, and everybody will promptly forget about the trials and tribulations that we're going through right now.